Good evening, Mount Vernon. This is Mayor Sean Patterson Howard. I'm just going to take a few moments and wait till we build a little bit of a crowd before I jump in to the information. But today is April 1st. No, not April Fool's Day, but April 1st in the United States this year stands for Annual Census Day. So today is the major kickoff day for the census here in the United States. But I'm still going to just wait until we build a little bit of a crowd and get people in before I start. Where are we right now?
26.
We have about 26. Give us a few more seconds and then we're going to start. Just don't want to have to go back and repeat everything. And some of you might notice I have a red eye. I don't have pink eye. I just bursted a blood vessel. My allergies and all the sneezing bursted a blood vessel in my eye. And so it's red. It'll travel across and it'll go away. No harm, no foul. It doesn't hurt. It just doesn't look good. But it doesn't hurt. It's something that happens every year with allergy season. All right, so we ready to go? Okay, so today I'm going to come to you, and I'm coming to you really just to share with you as I generally do on Wednesday, but we're going to talk more about COVID right now because that is what is on the hearts and the minds of so many of the residents here in Mount Vernon, as well as us who are leading the city. You know, over a month ago, we started talking about COVID, and for many people, most didn't realize how serious this would turn out. Many of us thought, oh, this is happening in China, this is happening in Italy. It's not going to happen to us that way. And in the beginning, when we started receiving numbers from the county, the one thing that I said from the very beginning, people, do not focus on the numbers. And I asked people not to focus on the numbers because I've worked in infectious diseases for 30 years, going back to 1985 when I was working in HIV/AIDS. And anytime any type of virus or infection or health issue starts in a community, people look at the numbers. But what we know, those of us who work in infectious diseases, is for every one person that you know that's diagnosed, there's probably another 5 to 10 that you don't know or diagnose. So I never wanted people to get comfortable with, oh, we only have so and so many cases. Like I said, based on whatever case numbers you know, always multiply that by at least 5. And that's going to give you a much more accurate account of what we've had. And a month ago, Mount Vernon's numbers were 1, and then 4, and then 8, and then 11, and then 25. And today, based on a backlog of 2,000 cases that we knew they were waiting to put into the system to update us, we knew that the numbers that we were still getting from the county were still low based on what we were hearing in the community. And so yesterday, I think our numbers came out to 268 yesterday. But today, when we went into our portal, we saw that our numbers were at 382 cases. Now, for many of you, that might be a shock to your system. It's not for us because we knew that people had been going to get tested. We knew that people were getting sick. And we've also heard much more over these past few days that there have been people who have died. Mount Vernon, these numbers are not going to immediately go down because people have been getting infected for the last month, and we're going to see more infections continue to come. The only way that we can reduce these infections from spreading over and over and over again is for people to practice social distancing. I know that sounds corny, and I know that sounds simple, but if you're around a person with a cold, you usually try and stay away from them. The challenge with COVID is that oftentimes people who are infected can infect you before they even start displaying symptoms. And so by the time you know that someone in your family has it or someone who you work with has it, you could potentially already be infected. And so what we have to do in our community, not just in our community, but even in our homes, is practice what we call universal health precautions. Universal health precautions means you treat everybody in your family, in your friend circle, at your job, and in the community like they're COVID positive. I see people get up and they put on masks and gloves when it's time to go into the store. But when you're hanging with your friends on the block, or you're sitting in the park talking to people, or in the supermarket with people that you know, we put our guard down and we act like our friends and our family cannot infect us. If they don't know they're COVID positive, they can absolutely and will infect you because they don't even know. So if we practice social distancing, that is staying 6 feet apart from each other, whether you're in the house, and sometimes many of us might live in small apartments where it's hard to practice that level of social distancing, but we have to make an effort to try. You know, I've spoken to some people who are positive, and not only they positive, but the husband, the wife, multiple children in the household are positive. And so once again, we have to, whether we're outside in the community or we're at home with our family or we're with our coworkers, practice social distancing. I had a meeting this morning with 9 people. We left seats in between each of us, and we made sure even across the table is over 6 feet wide. It's a very big conference table, but we were very serious about social distancing. And those who chose to use masks in that area, we weren't offended because we understand that people want to protect themselves. But if we treat everyone like they're COVID positive, then we're going to help flatten this curve. The other thing that we want to remind you to do is one of the simplest things that you could do. Wash your hands. Constantly wash your hands. If you're going out and you go to the supermarket and you come back, wash your hands. If you're going to the laundromat and you're coming back home, wash your hands. Everyone may not have gloves because there is a national shortage of gloves. There is a national shortage of masks, and they are in great demand. You know, if you look at my mask is pretty well worn. I've been carrying this mask around with me since last Thursday. And so I don't get a mask and toss it. These are reusable masks, and I have to use this mask over and over again. I don't go anywhere without my little hand sanitizer that I have. Now, this didn't come free from the government. It's hand sanitizer that I was able to go to the store and get you a small thing of hand sanitizer. We've had people who said, well, didn't the government send down hand sanitizer? They sent down hand sanitizer for us to bring to the hospitals, to the daycare centers, to some of the businesses that are essential businesses, for us to give to our police and our fire department. These are what they call Tier 1 facilities. So the governor did not send down, enough sanitizer for 100,000 people in Mount Vernon. He sent down some sanitizer for us to be able to give to daycare centers, because many of our daycare centers are open so that our essential employees and our first responders can continue to go to work. So we have to provide them with sanitizer. We have to provide additional sanitizer to the hospitals. We have to make sure that police and fire and DPW have hand sanitizer. So there's no closet in City Hall or anywhere in city government where we're holding sanitizer that the governor gave us for free and we're keeping it away from the people. Go to CVS. CVS has been getting in regular shipments of sanitizer. Supermarkets have been getting in regular shipments of sanitizer. So go to these places and get your sanitizer and hold on to them. Don't hoard it, and don't try and sell it on the street, because that's not fair. We're going to ask you, I'm going to pause right now. Please take a minute and share this video. Share this video. I'm asking you to take a second, share the video, start a watch party, because we want to make sure that as many people who want this information are getting this information. So not everyone knows to look on my page, but if you share the video or you start a watch party, your friends are going to jump in and get it, because we're going to be giving out important information. And the best way that you could help us change and arrest and stop COVID in Mount Vernon is when you see me coming on live to give you updates and information, that you immediately take a moment to share the video. So go down and hit share, and it'll give you an option to either share it on your store, on your page, or to start a watch party. Starting a watch party will usually reach more of your friends. I'm not just trying to look to get views and to like and get likes. What we're looking to do is make sure that we're reaching a wide audience. So please take a moment and share this video or start a watch party. Okay. So I'm going to go back and say what we said a few moments ago. The cases in Mount Vernon went yesterday from 268 up to 382 cases today. Now that doesn't mean that in the last day 120 people got COVID. It just means that the reporting system that we get from the county and from the state lags behind. Literally, they gave about 2,000 cases today for someone to put into a database so that we could get information. Another thing that I want to tell you about these cases, we have 382 cases, but we only have 2 clusters. And what is a cluster? A cluster we're defining as 20 or more cases. And so we had a cluster of cases at the rehab center, Westchester Rehab, and we had a cluster of cases over at the Wartburg. Outside of that, if we take those 50 cases aside, the other 330 cases are in more than 150 to 165 locations. We are tracking addresses, so there's not one neighborhood or one apartment building or anything like that that's being hit. We saw some false information on one of the Mount Vernon blogs, I believe it's Mount Vernon News Center, saying that they got from a good source that there's a cluster of cases on the south side. There is not a cluster of cases on any block. There are cases, these cases go all the way from Fleetwood to Bond Street, from Kingsbridge Road to the Hilltop. They're everywhere. So we have people who are COVID positive in Mount Vernon at over 150, 160 different addresses and locations. We might have a few people in one house who are COVID positive because of what? Because they live together and they've infected each other. But people are quarantining themselves. I can promise you, no one's interested in running around and trying to spread COVID throughout Mount Vernon. People who we know are positive are like, please, we're good. We don't need you to deliver groceries. I call and I talk to different ones when I find out, and we try to see if they need anything. And they're like, we are good. We just want to get through this and make sure that we don't infect anyone else. So I want us to know the difference between fact and fiction. There are people who want to get their come up socially by scaring our community, and we cannot allow that to happen. We have to stay unified. So when it comes to testing, one of the things that we've seen is that there is a very short supply of test kits. And because there is a short supply of test kits, people getting tests are becoming, I need to drink water. People getting test kits, it's becoming more and more difficult for some people to get testing. So in the beginning, if you felt you had been exposed to someone who had tested positive, you were able to get a test. That's no longer the case. Then it changed to if you had symptoms, a fever or some aches, you were able to get a test. That's no longer the case because we have a short supply of tests throughout the state and throughout the country. Now the new threshold is you have to have a fever, you have to have multiple symptoms, and you have to go to the ER or the hospital or the one New York State testing site that we have in Westchester, which is in New Rochelle, to get a test, and they will assess you to determine if you need a test. So it's not as easy to get tested as many people believe. They are holding the tests to make sure that they're really only testing people who most likely are positive. They're not testing you because you're fearful or because you're anxious or because you're worried that you might have it and you just want to go and get a test. Because the tests are in such short supply, it is becoming more difficult right now to be tested. But that doesn't mean that we're sitting down and we're sitting still with that. Mount Vernon has more cases in our community than several counties in New York State. And so we've teamed up with our Senator Alessandra Biaggi and with our Senator Jamal Bailey, and we have written to the state to demand that they put a testing site here in the city of Mount Vernon. We've been making phone calls for the past 2 weeks but we've committed this to paper. And we sent a letter to Governor Cuomo and the New York State Department of Health asking them to put a testing site in Mount Vernon. Why is Mount Vernon unique? Mount Vernon is one of the most densely populated communities in the state of New York and in the country. Mount Vernon is the only one of the only minority-majority communities in our region outside of New York City. And why does that make a difference? We also know that we have major pockets of poverty. So we're densely populated, we're majority minority, we have large pockets of people who are low income, and we have a high percentage, over 15% of our residents are seniors. It's not easy for us to go to New Rochelle and get tested. It's not easy for us to go down to Co-op City, who just got a testing center, to get tested. We're densely populated like Co-op City. And so we are calling on the governor, we are calling on the New York State Department of Health to provide us with a testing center. Yes, we do have a hospital, but our hospital has a very high threshold for people to be tested. In New Rochelle, White Plains, Yonkers has 2 hospitals. It's easier for people to be tested in those communities. And so we are calling on Governor Cuomo, we are calling on the New York State Department of Health to reconsider Mount Vernon's repeated requests, our repeated requests to have a dedicated testing center here in Mount Vernon. We could put it over in the parking lot near Grace. We could put it at the Neighborhood Health Center. We can create a testing location down at Hutchinson Field or down at Brush Park, but we definitely need a testing center here. Now, that doesn't mean we're going to get it, but that doesn't mean that we're going to stop asking for it. We want to make sure that Mount Vernon residents have fair and equal and easy access to testing. So, social distancing. We talked about that a little bit in the beginning of this live, but we have created a social distancing task force. We created this task force about a week and a half ago, and they continue to ramp up. So the social distancing task force really focuses on ensuring, it focuses on 3 things. It focuses on ensuring that businesses that are essential, like supermarkets and pharmacies and banks, and businesses of that nature, the hospital, our police department, our fire department, that we're operating within the proper social distancing guidelines. Not just people staying 6 feet away from each other, but we want to make sure that these essential businesses are putting into place protocols that are going to keep their workers safe, but are also going to keep their customers safe. And so if you notice at several of the supermarkets like Stop and Shop and La Placita, they've put up plexiglass in between the cashier and the customers. They have on the ground that, different markers where you have to stand to make sure that people are maintaining that proper social distance. That's very important. And I'm going to say this. I'm going to say this to you, Mount Vernon, because you're just as responsible for making sure that these businesses operate in your protection and in your best health interests. If you go to a store and they're not practicing social distancing and that they don't have any type of thing in place to make sure that their workers are safe, but that you are also safe, don't shop there. If you go into a supermarket and they're not using social distancing, if they're allowing their store to be crowded and have people locked up in there like cattle, don't do business with them, because then they're only concerned about making money, but they're not concerned about your health. And you have the right to turn around and walk out. And if you go to those managers and you continue to say to them, why aren't you practicing social distancing? People realize, and they will change their ways when they realize it hits their pocket. And so if you choose not to continue to give your money to places who really don't care about your health, and they're not practicing social distance, they'll get the message and they'll call in an extra security guard. They'll put lines down on the floor. They'll go out and they'll invest in some plexiglass. These things are not very expensive. They can make money. They have the privilege of opening and continuing to do business. Then they need to make sure that they're making the proper investments to protect your health. You also want to make sure that these stores are sanitizing and that they're cleaning, and that the people who are handling fresh produce and are over the fresh produce have on gloves and that they're using universal health precautions. You as a customer have the right to demand that the places that you're doing business with are doing good business in the protection of your health. And so that's what we're doing with the supermarkets and the bodegas and some of the other places. Now, yesterday when I went on 4th Avenue, I was shocked and I was actually quite pissed off that there were about 10 businesses that were open on 4th Avenue. And what did I do yesterday? I shut them down. I shut them down along with the police department and along with some of our PD and along with DPW workers, because the hair depot on 4th Avenue was open and there were people in there buying hair and getting color for their hair. Now, I love my hair and I like to keep my hair done, but it is not an essential business right now based on what the governor said. But unfortunately, they used, and other stores have used, a workaround, and they've applied to the New York State Economic Development, Empire State Economic Development Corporation, and they've filled out paperwork and they've told the state, oh, but we sell essential items like hand sanitizers and masks and things that the community needs and they can't get anywhere else. But that's not what they're doing. They're selling hair, they're selling hats, they're selling scarves. You can get those things later on. Those are not essential items. And again, they're not practicing social distancing. And so we shut them down. And what we've also done today, after contacting the New York Empire State Development Committee agency and Tish James, our Attorney General, we've asked for them not to give exemptions to every Tom, Dick, and Harry store that wants to consider themselves essential and have you coming in there and they're not protecting you and they're not investing in safe business practices. So again, be mad at me if you want to, but I'd rather your hair look busted than me getting information about you being in the hospital in ICU because you've been COVID exposed. People want us as a government to protect you more than you're willing to protect yourselves, and we just can't do that. We have to, in order for us to really flatten this curve and make sure that this apex that everyone says is coming does not hit us the way that they are predicting it's going to hit us, is we have to get you to change your ways. We have to get you to understand that your health for the rest of your life is more important than getting your hair done and hanging out on the block and shooting dice with your people. You have to change your ways. Mount Vernon, if we can really knuckle down and come together and practice what we know are these best practices to stop COVID in its track or really reduce it for the next 3 weeks, we can make a difference. I cannot arrest people out of this problem. I see people on Facebook saying, well, you just have to arrest people and put them in jail. They're not going to put people in jail right now because they don't want COVID to spread in the jails. They're not going to do that. And then we are a minority community. We're not just trying to help people catch a case and go to jail, but we are asking our community to help us put social pressure, peer pressure on your peers to tell them, stay at home, stay out of the streets. And if you are in the streets, if you do want to go sit in Hartley Park for a minute and just chill out and get fresh air, or you do want to walk down the street and get fresh air, we understand that you're tired of being cooped up in your apartments. We understand that you are frustrated, your apartments and your houses or whatever might be small. You need some free space. You miss work, you miss school, you're tired of dealing with the kids all day. We get that, but we do not want Mount Vernonites to continue to lose their lives. And we've had over 20 deaths in our community that we've been able to track just on social media. And by speaking to people and getting phone calls from people, we cannot continue to have this number increase. New York City had over 250 people die in one day. I don't want 10 and 20 people dying in Mount Vernon in one day. That's devastating. Any loss in our community is devastating, but we need your help. We need your help. So like we said, we have the social distancing task force, That is our police, fire, recreation, Office of Emergency Management, and DPW. They're ramping up. They're making sure that businesses that should not be operating are not operating. And they're also working with our police department to continuously move people along in the streets. So businesses that are non-essential that continue to try and operate will be fined. We will be finding these non-essential businesses as well as construction sites with daily fines of $10,000. $10,000. So the business community, if you are not an essential business and we catch you operating, we will give you a warning, and then we will be issuing fines of $10,000 apiece. I think it's best for you just to stay closed and help us arrest COVID in Mount Vernon. When you see something, they always said, when you see something, say something. And so we have created a hotline here in Mount Vernon. If you see crowds gathering and if you see businesses not practicing social distancing, then here is a hotline for you to call. Please take out a pen. You can call here in Mount Vernon 914-665-2626. If you see businesses that are non-essential, that are operating and not following, that are operating, that should be closed, call this number. If you see businesses that are essential and are operating but not following best practices, call 914-665-2626. If you see groups of people who are gathering, people like, well, I don't want to snitch on people, but then these are the same people. Our police officers cannot be everywhere just making sure that people are not gathering. So again, if you see something, say something, and we will send a patrol car out there to break up the crowd and move them along. Now, we know when the police move, oftentimes they're just going to go back to doing what they're going to do, but that's where we need your help as the community to really, the people who are standing outside in front of the bodega, half of the time they're your kids, your cousins, your nephews, your neighbors. Y'all have that conversation with them too, because we have to do this together as a community. If you hear of churches operating and gyms that are opening on the low and parties that are happening when the gate is pulled down, let us know. We'll follow up. We don't need you to go out and be the social distancing cops and put yourself in trouble, but we will follow up for you. So one of the things that we've done from the beginning, because we knew that people were losing their jobs, we knew that people were getting laid off, we know that people who are entrepreneurs and usually operate cash businesses like hair salons and nail salons, that with your stores being closed and your businesses being closed, we've had increases in requests for food. So with City Hall being closed, one of the things that is happening is that our Recreation Department and our Youth Bureau are working very close together to make sure that the people in the community who are hungry are getting food. And so on this Friday, in Lot 1, on 5th Avenue and 2nd Street, or 5th Avenue, between 5th and 6th Avenue and 2nd Street, we will be distributing food again. We have non-perishable foods, cans and pastas and things of that nature, as well as we'll have fresh produce here. And we will make sure that people are following social distancing guidelines there. So when you come, you will be put on line. You will have to stand 6 feet away from each other. Our people will be wearing masks and gloves, so don't be offended when you see them in masks and gloves, because we need to make sure that the people who are helping to give out food are staying healthy themselves. And so we will be giving this food out starting at 3 p.m. at Lot 1 on 5th and 6th Avenue at 2nd Street, right across from Grace Baptist Church, that really big parking lot. That's where we'll be giving food out on Friday starting at 3 p.m. We will give out the food until it's gone, but we have tens of thousands of pounds of food, and we ask that you come out, you bring your bag, you bring your shopping cart, whatever it is that you need, and we will be distributing food. So people have asked a lot of questions about Mount Vernon Hospital or Mount Vernon Montefiore Hospital. We know since October we've been fighting to keep Mount Vernon Hospital open. Not that they're the perfect hospital, but in a time like this, we need our hospital more than ever. And we are working with our city council, with our county legislators, and with our state representatives in Albany, our state assembly people, our state senators, as well as our United States Congressman Eliot Engel, to keep Mount Vernon Hospital open. The governor has ordered that Mount Vernon Hospital reopen fully and completely, meaning that all of their beds are made available and not just some of their beds. So they have ramped up and they have prepared those rooms to be open. One of the biggest challenges that we're experiencing right now, if you look at the governor's updates, if you look at the county executive's updates, if you look at any national CNN or MSNBC, you're hearing that there is a nurse shortage and there is a shortage of doctors and healthcare workers. And so the hospital is open and prepared and ready to open fully, but we're going to put out, again, as the governor has done and as the county executive has done, we're putting out a call for anybody who is a retired doctor or a retired nurse. If you're a retired doctor and you're a retired nurse and you can give time to volunteer to help us fight COVID or be hired temporarily or per diem, please reach out to the mayor's office at 914-665-2360. If you are a retired doctor or nurse, a healthcare professional, and you are willing to volunteer your time, or if you're interested in per diem work, please reach out to us at 914-665-2360. We can open up rooms, but if we do not have nurses and doctors to provide services, if you're paying attention and you're looking at the news, everyone in the region and every hospital system in the region has been overloaded. They're opening up the county center as a hospital, Jacob Javits Convention Center as a hospital. They're bringing in floating hospitals. They're doing all of this, and all of these locations are competing for nurses and doctors. And so we need help so that we can fully ramp up our hospital to be ready. A lot of our nurses and our doctors have been infected with COVID and are out of work right now at home trying to get better so that they can come back to work. And we also have others who are in intensive care and on respirators. And so our frontline professionals in the healthcare industry are being impacted, and that is making it very difficult to fully open up our hospital and have them ramped up 100%. Just to help you understand the devastation of what's happening, some people you'll see on 8th Avenue behind the hospital, you're going to see two big trucks. Those are refrigeration trucks, and those trucks are simply for bodies because people are dying. I cannot say this any more seriously. I can't put this in a nice way. Where people are dying at Mount Vernon Hospital, New Rochelle, Lawrence Hospital, St. John's Hospital, St. Joseph's, White Plains Hospital. All of our hospitals in the region right now are ordering refrigeration trucks because they cannot get the bodies moved quick enough. This is just the facts. I'm not trying to sensationalize this. You say you want the truth, I'm going to give you the truth. I don't want you to see big white trucks behind the hospital and have someone tell you, oh, they're for this or for that. No, these are for people who have died, whether it's COVID or another reason, and there's just no place right now to move these bodies fast enough. I need the community to understand how serious this public health crisis is. It is very serious. It is not a game. No one could have told me a year ago when I started running to become mayor that in my first 2 months of office, that one of the biggest things and my biggest responsibilities would be hit with a worldwide pandemic where we're going to see our neighbors and our friends and our classmates and people in our community dying, and that I would have to sit there, unfortunately, and watch this happen. We're not just sitting here watching it. We are begging you and we are pleading you to partner with us and to follow social distancing guidelines and stay at home if what you're doing is not essential. Please, please. We will be providing you with regularly scheduled updates. We've put out over 20 videos, but we will be providing you. So please pay attention to this. On Sunday nights at 8 p.m., on Sundays with Sean, we will be providing you with updates on COVID. On Sunday nights at 8 p.m., we will be providing you with updates on where our community stands with COVID and what we're trying to do to combat it and to flatten the curve. We're also will provide you during the week with regular updates on Tuesdays and Thursdays. On Tuesdays and Thursdays, I will do lives, and we will rebroadcast these on our city's website as well as our cable access channels, our public channel on cable. So on Tuesdays and Thursdays at 3 p.m. there'll be live updates, and then they will be rebroadcast on Tuesdays and Thursdays at 9 p.m. So just like you see the governor give updates every day at 11 a.m., on Sundays at 8 p.m., I will be giving live updates. And on Tuesdays and Thursdays at 3 p.m., we'll be giving live updates, and we will rebroadcast these updates on Tuesdays and Thursdays at 9 p.m. That's the schedule, and we will publish it and post it for you. As of today, the county informed us that they're going to kind of stop sharing the numbers because the numbers, again, are behind. They're lagging several days behind. And we, right now it's just shock value. As I said to you in the beginning of this broadcast, that right now we have here in the city of Mount Vernon, 382 cases. That's up over 100 reported and confirmed cases from yesterday, but we know that the reporting lags behind a few days. As I said earlier, I want you to assume for every one case that we know about, that there's 5 people who we don't know about. So we probably have more like 1,500 people walking around, and people will not know that they're COVID positive until they start displaying symptoms. So you can't blame people if they infect you and they don't even know that they have it themselves. So we're asking everyone, again, to participate and practice universal health precautions. Treat everyone you know like they are COVID positive. Alternate side of the street parking is still in effect. It's been in effect. Alternate side of the street parking is still suspended. Alternate side of the street parking is still suspended. And for many of you, that's going to be good news. But anytime you try and solve a problem, you create another problem. And this is something I said a few weeks ago. And so right now, we have not been able to get to most of our residential streets and clean them. And so we're dealing with larger numbers of pests that are running the streets right now in many of our residential neighborhoods. Another thing that, because we can't bring the street sweepers through, a lot of people are taking your gloves. Yes, you go out and you protect yourself by wearing the gloves, but you don't just throw the gloves in the street. You gotta stop just throwing the gloves in the street. And so that's gonna cause another problem. Not only are we dealing with gloves all in the street, but as those gloves start to get into our sewer system, because we can't get to them, then the new problem that we're gonna have here in the community is that the sewer system is gonna back up and it's gonna fail. And if the sewer system backs up and fails, then that means you can't flush your toilet properly. And if you can't flush your toilet properly and all of your family is stuck in the house and quarantined, then you're gonna have problems in your house. So trying to solve for one problem oftentimes creates another problem. What I have tasked my DPW Deputy Commissioner with today is creating a schedule for us to be able to do street cleaning at least once a week in each quadrant of the city. So the Southeast Mount Vernon, Southwest Mount Vernon, Northeast Mount Vernon, Northwest Mount Vernon. We're used to cleaning each neighborhood twice a week. Right now, we've suspended that because we've suspended alternate side of the street parking. We are working on a schedule, and we will be putting this schedule out where we will be asking you at least one day a week to move your cars between certain hours so that our street sweepers can get through and clean your block. And we're going to need your cooperation with this. We're going to allow you to use the city parking lots on those days when you have to have street cleaning done to move your cars, and then you'll be able to move your cars back. But we have to clean the streets. We can't just let infection and infected gloves and dirt and grime just sit on the streets because people don't want to get up and move the car. We are providing you with the alternatives of the city parking lots and the school parking lots that the superintendent has graciously allowed us to use. So we need you to do your part, because we cannot have all of this going down into our sewer system, backing up and breaking down our sewer system. So please, again, partner with us. I know this is a long update, but if we could watch the governor for an hour talk about stuff all over the state, we're trying to give you information that is specific to Mount Vernon. Work with me. Another part of what's been going on is our parks, our playgrounds have been closed because we cannot spend our time sanitizing playground equipment. Our playgrounds have been closed. We have taken down basketball courts because that close body-to-body contact is another thing where COVID is spreading in our community. And people can't use social distancing playing basketball. And so again, we have closed the parks and we have taken down the basketball courts. We are looking to start sanitizing our streets in the evening with our DPW water truck. We're working on that. But again, we're asking you to do your part by just not throwing stuff in the street. We want to clean the streets. We want to sweep the streets. We want to work on sanitizing our community, and we're going to need your help in doing that. We know that you're home, and we know that a lot of people are afraid. But one of the things that we're asking, please only call an ambulance in case of an emergency. Not just because you're afraid. We need you to call the ambulances in case of an emergency. We do not have an unlimited supply of ambulances in the city of Mount Vernon, and we have been utilizing the ambulances from our surrounding communities, and they are saying that they cannot continue to respond to Mount Vernon's calls before they respond to their community's calls. So we're asking that people not just call 911 and order an ambulance unless it is really an emergency. In the past 2 weeks here in Mount Vernon, we have had 350 ambulance calls for ambulances. And 110 of them have been COVID specific. So we know that there are more things happening in Mount Vernon right now than COVID, but also know that COVID is taking up a lot of our ambulances' time. And if we have to take people outside of the community to another hospital, it's going to take a longer time for that ambulance to get back. And then also with COVID, we have to sanitize the ambulances. And so those ambulances are out of service for longer amounts of time. And our response time to your call for an ambulance may not work really well. So if you have the ability to transport someone to a hospital instead of calling an ambulance, we're asking that you take that option because we may not be able to get to you for a while. We are in the process of working to get more ambulance companies to come into Mount Vernon. That is something that we are actively working on. But as you see on the news, every community is stricken and impacted by COVID, and ambulances are at a premium. So we're asking that you only call 911 in cases of emergency, because the ambulance system throughout our entire region is overburdened right now, and we want to make sure that we're using it in the wisest way possible. As I said to you earlier, we are working with our public access station to make sure that we're able to take these updates and also run them on our public access station. We know that not everyone has Facebook, Instagram, and Twitter. We know that not everyone is going to go up on our website and look at this information on our website. We know that not everyone is watching the news. But we also can't knock on every person's door in Mount Vernon on a daily basis and give you an update to what's happening. And so that's why we're going to also now use the public access station. So please, we will put out a schedule, share that information with people, and like we said, share these videos. And I'm going to end again on updating you just again on the census. Please, Mount Vernon, we need to make sure that we're all counted. We do not want to leave money on the table. The census is very critical. Mount Vernon, over the next 10 years, can potentially lose out on over $800 million of funding for community programs. What type of programs? We can lose funding for our hospital. We can miss out on funding for street repair and road pavement, for fire department, police department, for schools to be built, for job training, for reentry services, for mental health, for youth services, for senior services, for upgrades to our sewer and critical infrastructure projects in our community. Over $800 billion comes down every year from the federal government to state, county, and local municipalities for these types of services, but it is based on our census numbers. And if we're not counted, then we won't count. So I count, you count, we count, Mount Vernon counts, and we need your help. We cannot, because of COVID, go and knock on doors right now. And so since you're at home, I'm asking you to take out a moment to go to www.2020census.gov. You could fill out the questions. It'll take you no more than 10 minutes for your household, unless you have a large household. But go and complete the census. It's 10 minutes, and it helps Mount Vernon compete for and also get money automatically based on our popular internet. Then if you will dial and work with them, you can call. The census number is 1-844-330-2020. 1-844-330-2020. And there will be census people ready to take your information from 7 a.m. to 2 a.m. We want to make sure our seniors are being counted. We want to make sure our young people are being counted. We want to make sure our new residents who have immigrated to the United States, whether you're a citizen or not, are being counted. We want to make sure all of our neighborhoods are being counted. We cannot lose hundreds of millions of dollars over the next 10 years. And I'm going to close out with this. Here are some hotlines. If you want to call the state for testing, the state COVID testing hotline is 1-888-588-0195. 1-888-588-0195. County testing hotline 914-813-5000. 914-813-5000. Those are the county and the state hotlines. Emotional and mental health services through the state of New York, 1-844-863-9314. If you're feeling anxious or depressed and you need some emotional and mental health support, don't be afraid to call and get help for yourself. Again, 844-863-9314. If you are a small business and you're looking for resources and you want to know through the County of Westchester what type of supports and services are available to you as a small business, you will contact 914-995-2900. 914-995-2900. If you have become unemployed because of COVID, or you're just unemployed right now, here is the number for unemployment. You have to do these applications online and over the phone. So unemployment assistance, 1-888-209-8124. Unemployment assistance, 1-888-209-8124. And lastly, we're going to repeat this again. If you want to report social distancing violations or businesses that are not operating properly, you can contact 914-665-2626. 914-665-2626. And before we close out, again, I just want to give my condolences to the families in our community who have lost loved ones, whether it's to COVID or to other issues. We know that we have seen so many deaths happening in our community. We're seeing it on social media. Please know that we are praying for you. Please know that we care about you. Please know that we understand that this is a difficult time that's being made even more difficult because it is hard for you to plan services for your loved ones because you can't have services for more than 10 people. For those of you who are COVID positive, and you're feeling isolated, you're feeling alone, you're afraid that people are judging you, please know that we're praying for you. If you're the family members of someone who's COVID positive and you're frustrated and stressed because you cannot visit them at the hospital or in the nursing home, please know that we are here. We are praying for you. We are here to support you. We understand that this is not an easy time. And for the people who are being released from the hospitals and who are returning home, and you've gotten off the ventilator and you're feeling better, please know that we are excited for you. We're asking that you still continue to heal and rest before rushing back to work. We know many of you want to get back to work, but we want to make sure that you are just well rested and well healed. And for those of us who are not COVID positive, please, let's continue to practice social distancing. Let's continue to pray. Let's continue to be responsible. Let's continue to reach out and to support our neighbors who are struggling and who are having a difficult time. And let's remember, like in any time of crisis, that the only way that we can come through this is that if we're supporting one another. We can't be divided over politics. We can't be divided over neighborhoods, and we cannot allow ourselves to be divided over pettiness, but we all have to come together, do our part, strengthen and upbuild our community, and we will beat COVID together. Mount Vernon, we're gonna come out of this, and when we come out of this, we're going to be stronger, and we're going to be better. I care about you, love you guys, God bless you, and as always, I'm praying for you. Please take care.